Just got my nails done and I have immediately started acting different. You know? Just got my nails done and I have
Somebody is not muted.
acting different.
All right. And were you able to let people in?
Yes, I believe we are live.
Okay, great. I'm going to call the meeting to order. It is 7:26 p.m. Start with a roll call of board members. Dr. Tyra Bryant-Stevens. Dr. Anna Diaz-Rue.
Here.
Dr. Marla Gold. Here. Dr. Jennifer Ibrahim.
Here.
Dr. Amit Ismail, I think is not here. Dr. Scott McNeil.
Here.
And Dr. Ayla Stanford.
Here.
Thank you all. So I just want to mention that the board was just in executive session to receive consultation with attorneys in the law department in connection with litigation related to the flavored tobacco ordinance, section 9-639 of the Philadelphia Code and the Board of Health regulation relating to the sale of flavored tobacco products. We're going to, I'm going to make a move to amend the agenda to remove the vote on the rescission of the regulation. Is there a second?
I'll second.
All in favor of removing that item from the agenda?
Aye. Aye.
Any opposed? Great, thank you. Now I'm going to turn things over to Ben Hartung to explain the public comment process.
Thank you, Dr. Bedegal. Good evening, members of the public. My name is Ben Hartung. I'm the Public Policy Advisor for the Chronic Disease and Injury Prevention Division of the Philadelphia Department of Public Health, and I will be receiving your comments tonight on any of the agenda items that the board will be voting on. To submit a comment, you can send an email directly to me at benjamin.hartung@phila.gov. That's BENJAMIN.HARTUNG. And another way you can submit comments is by using the question or chat function in the webinar here. And I just want to let you know that the board is required to review your comments, but it is not required to respond to them or engage with those comments directly at this session. Finally, I want to let you know that this meeting is being recorded by video and audio, and by participating in this webinar, you agree that you will let your you agree that you're allowing that yourself to be posted online pursuant to Philadelphia Ordinance. So this meeting will be posted on YouTube after it is done. Thank you very much.
Okay, thank you, Ben. So I'm just going to review the agenda next. We just have one item now, amendment to the third consolidated and restated supplemental emergency regulation governing the control and prevention of COVID-19, consolidated safety measures for full reopening and delegation of authority. Has the board been able to review the meeting minutes? And any questions about the meeting minutes?
I move to approve them.
Second.
All in favor?
Aye.
Aye.
Any opposed? Great. So I think we have Joe reviewing this regulation. Joe.
Okay, so I believe you all have a copy of the regulation. This is an amendment to the third consolidated and restated supplemental emergency regulation governing the control and prevention of COVID-19 consolidated safety measures for full reopening and delegation of authority. The third amendment is, the third consolidated and restated supplemental emergency regulation is the regulation that you all adopted at the prior meeting. Or one of the regulations that you adopted at the prior meeting. And this is an amendment to that regulation. The body of the amendment just reflects the couple amendments that are made. Deletions are in strike through, additions are in bold. The whereas clauses just provide a little bit of background on what the board has done to date and changes since the board adopted that third consolidated and restated regulation. And so I'm just going to walk through what the changes are, and if there's any questions, please don't hesitate to let me know. So the main, one of the main changes under section 1 of this amendment is an amendment to paragraph B of the third consolidated and restated regulation, which essentially just updates the description of the safety measures and metrics that are going to be, at the time were going to be used for the health commissioner to determine and certify to the board that the city had reached the all clear phase. Since the board's vote and adoption of that regulation, those criteria have been met, and so the language has essentially been updated to reflect that the commissioner has in fact so certified to the board and the basis of that certification. Excuse me, I'm sorry, one moment. So it has been updated, and then subsection 2 is just adding language, breaking out language that had been in the prior section to state and clarify that the requirements regarding masking in indoor locations other than schools, healthcare institutions, and congregate care settings, which has been rolled back by the health commissioner's determination that the metrics identified by the board in the prior regulation have been reached, can be reinstated with any additional requirements that the commissioner deems appropriate or necessary pursuant to the authority that this board has granted the commissioner under that prior regulation. And then the second amendment is to the consolidated and restated safety measures themselves. So if we scroll to page 2, this regulation has a couple of additional changes. Specifically, masks are no longer, we're following Department of Health specific regulations related to masks rather than CDC specific recommendations. It notes that effective actually yesterday, the requirement to wear masks in school and childcare settings does not apply. Yesterday, the health commissioner rolled that back through both her administrative discretion regarding enforcement and regarding the authority that's previously been delegated to her to the board. And that prior to June 1, 2022, if a school, camp, or early childhood education has not held in-person sessions for children for 5 or more consecutive days, such as for a spring break or a holiday break, that the masking requirement will once again apply for 1 week following such break. So this is specifically to, if schools are having a spring break, this is specifically to require masking for a short period when sessions resume. And then finally, it's really subparagraph 3, essentially is again just a memorialization that the health commissioner has the authority to reinstate any of these masking requirements if she determines it's appropriate. And that's it for this one. If there's any questions, please let me know.
Like, I'm here to do a job.
I just wanted to check with Ben. Oh, Ben, you're putting them in. I was going to say if there were comments. Thank you.
Thank you, Dr. Ibrahim. Yeah, there were 2 email comments which we received prior to the meeting that I've forwarded to all your email addresses to review regarding this regulation. And then we've also received two questions that I've copied into the chat function right now. Let me know if you're not seeing those and I can forward them by email.
Commissioner Betteville, I have a question about the masking post-break. That's without testing. Can you explain the rationale for that masking period? I see that it's only until June, but it'd be nice to understand.
Yeah, so when we talked to the school district, there was worry that, what we saw with Christmas break was the kids went, they visited relatives, they visited friends, they traveled, and then they came back and we saw schools, I think we had 80 schools closed the first week. So just to try to avoid having that happen after spring break, we figured 1 week of masking after break would avoid that if it was going to happen. I think with cases as low as they are now, we're less worried, but we don't know exactly where we're going to be, and spring breaks, of course, vary in time. So it's just to avoid a post-break surge that closes down schools. And the wording is put this way, so it's not like every break forever.
Thank you.
Any other questions about this? Is there a move to adopt this regulation?
So moved.
Is there a second?
I'll second.
All in favor?
Aye.
Aye.
Any opposed?
And again, think about the fact that we are in relationship with you.
Okay. Thank you. I think somebody's not muted and there's going to be some background noise. Joe, a quick question. The document I have doesn't list another regulation, but was there something else we were supposed to discuss tonight?
So there is going to be a change, I believe, to the indoor dining mandate, specifically the metrics that are going to be used, if that's going to be rolled back or not at some point in the future, but that isn't something that is being discussed or is prepared for today. I think that's something that's going to be recommended to the board at a later date.
I apologize. Okay. Thank you. Sorry, I'm getting off my agenda here. I believe that's everything that we had on the agenda tonight. I want to thank all of you for your time, and we will be in touch about future discussions. Thank you very much.
Thank you.
Thanks. Have a good evening.
Good night.
Thank you all for joining.